Upon its introduction, the novel coronavirus has often been referred to as
It is the great equalizer.
but recent reports from the New York City Department of Health and Mental Hygiene reveal the outbreak is affecting Black and Brown communities at a higher rate than any other racial or ethnic group.
The deeper reality is that a pandemic of poverty, pandemic of racism, pandemic of consistent challenges existed before coronavirus hit our shore. And so this has just exacerbated the problems.
In New York, Black and Brown low-income communities are disproportionately affected by the pandemic, experiencing the highest death rates in the city. Assistant professor for the NYU Rory Myers College of Nursing and nurse practitioner Maya Clark-Cutaia explains the racial disparities that can occur in the healthcare system.
Hypertension, diabetes tend to affect patients of color more than it affects patients of those who are white in a disproportionate number. And as such, that is why none of us are really surprised that we're seeing this disparity in New York in particular.
In addition to pre-existing health conditions, low-income Black Americans and Latinos are overrepresented in many of New York's essential jobs, increasing the risk of exposure to COVID-19.
It's not just because there are health disparities, which they are. There were education disparities, there were economic disparities, there were transportation disparities.
Those people don't have the option to stay home because they have to go to work. The unfortunate part is we're not giving them the resources to protect themselves.
In an effort to protect those most vulnerable during this time, Blake, in collaboration with several other Bronx leaders, produced the Bronx Community Relief Effort with a mission to help meet the essential needs of the Bronx community. To learn more about the resources available, you can visit thebronx.org. Reporting for BronxNet, Kibin Aline.